The center's about making Tennessee a better state from a health standpoint. They want to keep Tennessee doctors in Tennessee. I really see that as their mission, is to improve the health of Tennesseans.
If you really look at our vision and how the Tennessee Center for Health Workforce Development evolved, it was really an opportunity for us to lead workforce development for the entire state.
For THA, no doubt about that the center is one of the most important pieces of our organization. Workforce is just going to be incredibly important as we go forward into the 21st century.
There's a lot of exposure, a lot of media spotlight on rural hospitals that are closing across the country. So without an organization like us that's in place to provide that ongoing support, there's not an opportunity to replace the providers that are either leaving or those that are needed to fulfill a vital service in those communities.
When I meet with residents, they're really excited about the diversity of opportunities that we're able to offer them. That's why we're here, to make your life a little simpler so that you can be of service to these underserved populations.
So we were worried about how we were going to pay off our debt. As everyone knows, medical school loans is pretty burdensome. I think initially when we found out about the center, it was such a relief to be able to have a contact who knew what to do, where to go looking for, how to get us the jobs that we wanted, as well as just to know that there was a way that we could get out from under our debt.
We give you money so that you can do what you love. It's not a loan repayment, it's simply money that you receive in your pocket.
So it's not only us recruiting on behalf of a rural hospital, it could be a community health center, a local health department, a private physician office. So the community as a whole is depending on us. It's so vital to the communities that we serve, but more importantly, the patients that are served in those communities. Because without access to high quality care, a lot of times patients will suffer.
I grew up in Middle Tennessee and then went away for college and then did residency in emergency medicine up in Boston at the Harvard hospitals up there. You know, there was a lot of things I pictured coming back and working in a small town ER. It's going to be suturing up people with horse hairs, and it's going to be, you know, just really primitive medicine. And it turns out it's none of that. We've got great physicians. We've got people that trained at Harvard and Stanford and Yale, a lot of Vanderbilt grads. So really good physicians. Surprisingly, in areas like this, you'll make just as much as your colleagues in the big city, and it's less expensive to live. So that, with the stipend of coming here, it takes a lot of that financial burden off.
When we talk about the stipend through the center, we're not talking about an insignificant amount of money. We're talking about tens of thousands of dollars that you get just for doing what you do. You get your salary, and then, oh, by the way, you get this extra money.
Just getting the stipend was life-changing. You know, we tell people we actually paid off our loans this past fall completely. And it was one of the best moments of our lives. It really was.
In working with the hospitals, we are a supplement. When we work with health systems, it's a win-win. We're able to help source candidates as well as provide you with money to get the best doctors into your health system.
We were struggling even with the idea of paying for relocation fees for the potential physician to move. We would not be able to afford such an incentive for recruitment because that's just not something that's in our budget. To have this incentive is really going to help.
There really is there's no downside whatsoever, because you're going to be, hopefully, you know, after residency, practicing medicine, and you're going to be doing it anyway. So why not get matched somewhere that you're going to be happy and oh, by the way, make extra money while you're doing it.
Being able to bring those providers to an area where access to care is extremely limited will keep those patients from having to seek care elsewhere, or the patient not being able to seek healthcare services at all. And our mission and the vision and where we're heading in the future will become even more vitally important as we go on.
When we continue on into the future, as we become what I would think would be the premier placement center for this state, particularly for rural and underserved areas, that the center will be the center of attention.